In this video, we examine the use of Serrapeptase during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Biofilms, adhesive coatings of microorganisms such as bacteria, are a fairly ubiquitous feature of cancer. In fact, research out of Johns Hopkins has noted that nearly all cancers originating in the right side of the colon have biofilm presence. These biofilms foster bacteria, which are associated with disease progression in digestive tract cancers. See doxycycline, our doxycycline, and immunotherapy videos. The matrix-like formation of the biofilm protects bacteria from destruction. In fact, antibiotic resistance can be 5,000 times greater for bacteria in a biofilm than not. Many models have examined how reducing biofilms can make cancer more vulnerable to anti-cancer therapeutics. Serrapeptase is an enzyme that was isolated from silkworms. It has been used clinically for nearly 70 years in Japan for its anti-inflammation, anti-biofilm, and anti-platelet aggregation properties. It is widely used in other parts of the world as well. Even though it is relatively unknown in the US, in fact, in India, Serrapeptase is regulated as a pharmaceutical. Serrapeptase is widely viewed as the most effective proteolytic enzymes that break down protein, at reducing inflammation. In fact, a meta-analysis of 5 randomized controlled trials found that Serrapeptase was more effective than ibuprofen and corticosteroids at reducing swelling and lockjaw after surgical removal of impacted molars. A prospective trial in 66 people undergoing surgery on their ankle found that 50% of the people receiving Serrapeptase had a reduction of swelling and pain on the 3rd day, while none in the control group did. In a randomized controlled trial with 70 patients who complained of breast engorgement due to edema, Serrapeptase produced a marked improvement in 22.9% of cases, while placebo only produced a 2.9% marked response. Over 20 human trials, mostly randomized and controlled, have been performed examining the effect of Serrapeptase on swelling, inflammation, and pain. Serrapeptase consistently demonstrates superior results. Serrapeptase also inhibits the pro-cancer inflammatory QX1 and 2 enzymes and has shown synergy with NSAIDs, which also inhibit the QX enzymes. Serrapeptase has been found to dissolve fibrinogen, an adhesive molecule that promotes cancer growth and blood clots. It was also found to reduce the adhesion efficiency of Staphylococcus aureus, cause of the common staph infection, to cervical cancer cells by 20% and reduced its bacterial invasion efficiency by 200%. Serrapeptase was the only proteolytic enzyme tested able to achieve this result. Adherence of these bacteria to cancer cells would worsen a cancer prognosis. Serrapeptase has also been found to improve airway clearance in people with chronic bronchitis, nearly doubling functional status, to significantly decrease the viscosity of mucus in patients with chronic sinusitis, and significantly reduce relative to placebo oral submucous fibrosis, a precancerous condition associated with biofilm buildup. The one piece of clinical data regarding Serrapeptase during cancer treatment comes from a case report where it was used along with ashwagandha and vitamin C to resolve a thyroid tumor. Despite this modest evidence, we believe Serrapeptase's unique mechanisms of action, long record of use in humans, and minimal side effects make it a promising addition to many anti-cancer regimens. For more information about serrapeptase, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.